Welcome to the deep dive. Today we're doing a custom extraction, really focusing in on a specific prescription medicine, Mounjaro.
That's right, tirzepatide. It's
Yeah.
made quite a splash in type 2 diabetes management.
Absolutely. So we've gone through your sources, the clinical data, safety info, all of it to pull out the essentials for you. And the core message from the start, based on the material, is that Mounjaro is proven effective.
Proven to help lower A1C, yeah. But critically, always alongside diet and exercise. That context is key.
Right. It's not a magic bullet on its own.
And our goal here for you, the listener, is to really understand the nuances.
Yeah.
What is it exactly? What does the data really show?
And crucially, what are those safety warnings? Why are they so prominent?
Exactly. We want to get beyond just the headlines.
Okay, so let's unpack Mounjaro itself. The basics. It's an injectable prescription medicine, right?
Correct. Given by injection.
And its main job, its approved use, is improving blood sugar glucose in adults with type 2 diabetes mellitus.
Always with diet and exercise, as we said.
But what makes tirzepatide, the actual drug molecule, different? What's unique here compared to other diabetes treatments?
Good question. So tirzepatide is interesting because it's first in class. It has a dual mechanism.
Dual mechanism,
It targets two different hormone pathways. It activates receptors for GIP, that's glucose-dependent insulin-tropic polypeptide, and GLP-1, glucagon-like peptide 1.
Okay, GIP and GLP-1. So it's hitting two things at once, unlike maybe older meds.
Precisely. Many other drugs focus primarily on GLP-1 or other pathways. This combination is unique to Mounjaro currently.
And what does hitting both GIP and GLP-1 actually do in the body, physiologically speaking?
Well, it essentially boosts the body's own systems for managing blood sugar. The GIP action seems to help with how the body releases and uses insulin.
Okay.
And the GLP-1 part that helps slow digestion makes you feel fuller and, importantly, reduces glucagon, which tells your liver to make less sugar.
So two different but complementary effects working together.
Right. It's like having two engines working to control blood sugar. And that dual action seems key to the strong results we're about to talk about.
Got it. But before we jump into the numbers, let's just quickly clarify A1C for anyone listening who isn't, deep in diabetes terminology.
Good idea.
We talk about lowering A1C as the goal. What is it?
So A1C, or glycosylated hemoglobin, is basically a measure of your average blood sugar control over the past 2 to 3 months.
Okay, like a long-term average, not just a snapshot.
Exactly. Sugar sticks to hemoglobin in your red blood cells, and A1C measures how much sugar has stuck. Lower number, better long-term control.
And the target we often hear about is under 7%.
Yes, for many people with diabetes, getting below 7% is a key clinical goal to help reduce the risk of long-term complications.
Perfect. Now we can really appreciate the efficacy data from the clinical trials. Because when you look at that A1C reduction, the numbers are pretty impressive.
They really are. The data reflects that dual mechanism we talked about.
So the sources break it down by dose 5 milligrams, 10 milligrams, and 15 milligrams.
Correct. Those were the doses studied.
And the percentage of people who reached that target A1C of less than 7%, it was high.
Extremely high. Between 75% and 90% of participants hit that goal, depending on the dose and the specific study.
75 to 90%, that's wow.
It is, especially when you consider where they started.
Right. What was the average starting A1C?
The average baseline A1C in these trials was somewhere between 7.9% and 8.6%.
So starting well above the target.
Definitely. Getting from, say, 8.5% down below 7%, that's a big drop. And seeing 3/4 or even 9 out of 10 people achieve that with one medication is quite remarkable.
It shows a significant impact on blood sugar control.
And it wasn't just a quick dip either. It's important to look at the timing.
Okay, what was the time frame for these results?
These results, the A1C reductions, they were measured at 40 weeks and also at 52 weeks.
So almost a year.
Right. Which tells you it's providing sustained, durable glucose control, not just a short-term improvement. That's crucial for managing a chronic condition like diabetes.
That makes sense. Okay, now, here's where the conversation often shifts, right? Because Mounjaro is approved for type 2 diabetes, but the clinical trials consistently showed another major effect: weight loss. Significant weight loss.
Yes, that's been a major point of discussion.
And the source material, the official information, is very clear. It states, and I'm quoting here, Mounjaro is not a weight loss drug.
It does state that very clearly.
But then you look at the actual data from the diabetes studies.
And the weight loss is undeniable. This gets into regulatory specifics. The drug is indicated for type 2 diabetes based on the trials submitted for that purpose.
But the mechanism itself, particularly the GLP-1 component.
Right. GLP-1 agonists are known to affect appetite and slow stomach emptying. So weight loss isn't entirely surprising from a pharmacological perspective. It's a known effect of that pathway.
So what kind of weight loss are we talking about? What did the numbers show in these studies?
The average weight loss reported ranged from about 12 pounds on the lowest dose, the 5-milligram dose, up to around 25 pounds on the highest dose, the 15-milligram dose.
12 to 25 pounds, that's not insignificant.
Not at all. And this was seen whether people were taking Mounjaro by itself or adding it to other diabetes medications they were already on.
And we should add the standard caveat. Individual results may vary.
Always. These are averages from clinical trials. Real-world results will differ from person to person.
But still, an average loss of up to 25 pounds is a pretty compelling side effect or co-benefit.
Absolutely. Especially in the context of type 2 diabetes, where weight management is often a critical part of the overall treatment plan. Even moderate weight loss, like 5 or 10%, can make a big difference in insulin sensitivity and other metabolic factors.
So a 25-pound loss could be genuinely transformative for some patients.
Potentially, yes. It impacts more than just blood sugar. It can affect blood pressure, cholesterol, joint stress, overall metabolic health.
Now, the sources also mention some real-world patient examples, people like Julia and Laura.
They do. And it's worth noting, as the sources transparently state, that these individuals were compensated for sharing their stories.
Right. That's an important piece of context for you, the listener. Personal stories can be powerful, but it's good to know the context. The robust evidence really lies in that clinical trial data, showing the 12 to 25-pound average loss.
Exactly. Anecdotes illustrate, but the aggregate data demonstrates the effect.
Okay, that distinction is clear. Let's pivot now, because this is arguably the most critical part of understanding any powerful medication, the safety information.
Absolutely essential. With significant efficacy often comes the need for significant vigilance regarding safety.
And Mounjaro has a very prominent warning.
It does, right up front in the prescribing information. It concerns a potential risk of thyroid cancer.
Okay, let's break that down carefully. Where does this warning come from?
It comes from studies done in animals, specifically in rats.
Rats, okay.
In those rat studies, Mounjaro and similar drugs cause thyroid tumors, including a specific type called medullary thyroid carcinoma, or MTC.
So, a risk seen in rats. How does that translate to humans? Because that's the immediate question, isn't it?
It is. And the crucial point here, stated very clearly in the sources, is that it is not known if Mounjaro will cause thyroid tumors, or MTC, in people.
Not known. So why such a strong warning based on animal data?
It's about regulatory caution. When a potentially serious risk like cancer is seen in animal models, especially mammals, the standard practice is to issue a strong warning for humans until extensive long-term human data can rule it out.
So it's a better safe than sorry approach, essentially, communicating a theoretical but serious potential risk.
Precisely. It's the standard for handling this kind of uncertainty, especially when the potential outcome is severe. Prudence dictates highlighting the risk.
That makes sense. So given this potential risk, what should patients be watching for? What are the specific warning signs they need to report immediately?
The symptoms relate directly to the thyroid's location in the neck. Patients are advised to contact your healthcare provider right away if they notice certain things, such as a lump or swelling in the neck, or if they experience persistent hoarseness.
Okay.
Also, trouble swallowing or shortness of breath. Any of those symptoms warrant immediate medical attention.
Got it. Lump or swelling, hoarseness, trouble swallowing, shortness of breath. Be vigilant about those.
Yes. And this warning directly informs the contraindications, the situations where Mounjaro absolutely should not be used.
Right, the non-negotiables.
Exactly. There are two main ones related to this thyroid risk. First, you should not use Mounjaro if you have a personal history or if any family member has ever had MTC, that specific type of thyroid cancer.
Okay, personal or family history of MTC is a definite no-go.
Correct. Second, you shouldn't use it if you have an endocrine condition called multiple endocrine neoplasia syndrome type 2, or MN2.
MN2. Why that condition specifically?
Because MN2 significantly increases a person's risk of developing MTC. So adding a drug with even a theoretical MTC risk in that situation is contraindicated.
Understood. MTC history or MN2 syndrome means Mounjaro is not an option.
Correct. And then there's the standard but always vital contraindication.
Which is?
A serious allergic reaction. If you've ever had a serious allergic reaction to tirzepatide itself, or to any of the other ingredients in the Mounjaro injection, you shouldn't use it.
Always important to check those inactive ingredients too if you have known allergies.
Definitely.
Okay, so let's try to synthesize this for you, our listener. We've covered a lot.
We have.
On one side, you have really compelling efficacy. Mounjaro, with its dual GIP-GLP-1 action, helps a very high percentage of people, 75% to 90% in studies, reach that key A1C goal of less than 7%.
A significant impact on blood sugar control.
And often accompanied by notable weight loss, averaging 12 to 25 pounds, even though it's not technically approved for weight loss.
Right. Those are the powerful benefits observed.
But then on the other side, you have this critical need for awareness and caution.
Absolutely. Understanding that warning about thyroid C-cell tumors, even knowing it comes from rat studies and the human risk is unknown, is paramount.
And knowing those specific contraindications, no MTC history, no MN2 syndrome, no serious allergy.
Being fully informed about both the potential benefits and the potential risks, especially the serious ones, is key to any treatment decision.
That balance seems to be the core takeaway here. Powerful drug requires careful consideration.
Exactly. And perhaps that leaves us with a final thought for you to reflect on.
Yeah.
Given what we see with Mounjaro, this dual-action mechanism driving strong results in both blood sugar and weight, it raises a bigger question, doesn't it?
How so?
Well, how will the way we classify drugs like this need to evolve?
Yeah.
You have a drug approved for diabetes, but with profound effects on weight, a closely related metabolic issue.
Ah, so you're asking if the labels and approved uses will eventually catch up to the sort of multifaceted reality of how these drugs work physiologically.
Precisely. As we develop more treatments that hit multiple targets in metabolic health, how do we best communicate their full range of effects and potential uses? It's something to think about as these types of therapies become more common.
Oh.